So welcome, June. Thank you so much for meeting with me today. So I'd like to start by knowing a little bit more about you, your organization, and your role within that organization.
So my name is June Sapio. I work for Northern Light Cardiology, and I am a Health Information Associate with Northern Light. And my role is to gather the necessary data for the providers for when the patients come in, to have them have as much knowledge as they can get, to know what the patient has been seen for, if they've been out of state, like what they need for documents and records for them.
So as a specialty office, tell me how using the clinical portal really provides coordination of care for your patients.
So using the portal provides us with the coordination of all the Northern Light, or um, actually all of the facilities within the state that we can get records from. It's all in one centralized area. So it's really important for us to be able to go to that one place. It's saves us an immense amount of time and phone calls, faxes, emails back and forth. So all this information is centralized, and we're able to just go to this one certain place and gather all this information.
So it sounds to me that you use this tool every day. So you're in the tool, in the health information exchange clinical portal every day looking
Yes.
for data. Is that correct?
Yes, constantly. Constantly. Yep.
So can you tell me what is the most important or some of the important data that you're looking for?
So our data that we specifically use is lab reports.
Mm-hmm.
So we pull a lot of lab reports. Some doctors' offices put their office visits in there. Some do not. We also have to do specialized radiology. We pull it from there. We get specialized procedures. So stress tests, EKGs, echoes, things like that. We're able to pull from this.
And lastly, could you share with me an example of how getting the data from the clinical portal has specifically helped a particular situation, if you could, without, of course, breaching PHI?
Right. So, we have patients that come in that are actually booked for the next day.
Hmm.
And calling a PCP office, they are actually allowed up to 30 days to provide that information to us. And having an HIN gives us, a 24-hour turnaround. We can get that information in for our provider, where the provider can see it within an hour and be readily available, so that when the patient comes in, the doctor is well versed in what the patient has had done, and is able to be on top of that. So it's really helpful for us for real-time information.
Well, I could not say it any better than that. Thank you so much for your time, your energy, and your enthusiasm for HealthInfoNet, but also your expertise and how you use it and how it's helping your organization as a specialty care. Thank you so much.
You're welcome. Have a good day.